this is Dr. Yemi Famuyiwa, your host of Fertile Talks, and I am happy to invite everyone to Fertile Walk 2025. This is going to take place Saturday, October 18th at 9 a.m. in Rockville, starting from 3202 Tower Oaks Boulevard. So this is more than just a walk. It's a fun, family-friendly day packed with health and fitness coaches, a live fertility and wellness talk, local businesses with interactive booths, and plenty of giveaways and surprises. And as an added bonus, the first 10 people to RSVP will be getting a signed copy of my new book that's coming out in March 2026. It's called The Quest for Fertility. Everyone who registers by March 2026 will also be invited to join our exclusive VIP book club with early book excerpts, bonus fertility tips, and special PDF resources. So, spots are limited. Please RSVP. Go to the link in the show notes and RSVP to save your spot. Can't wait to see you there. This episode of Fertile Talks is sponsored by ILMeds.co, an international mail-order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ILMeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started.
Today, we welcome back Yemi Famuyiwa. She's a fertility specialist. Today's Kevin MD article is When Bleeding Disorders Meet IVF, Navigating von Willebrand Disease in Fertility Treatment. Yemi, welcome back to the show.
Thank you. Nice to be here.
All right, so we're going to talk about a bleeding disorder as it relates to fertility, just to get everyone on the same page before we talk about the article. Just tell us what von Willebrand disease is.
So von Willebrand is actually one of the more common inherited blood disorders. And when people have it, they don't form blood clots very easily. So when they have even a minor cut, it tends to just bleed more, or they have nosebleeds that they just don't stop bleeding.
All right. And then tell us about the article and how that relates to fertility treatment.
Yes. So the reason I wrote that article is because I had a patient who had a history of von Willebrand's that was undetected. Mm-hmm. And she gave a history of having nosebleeds in the past. She had heavy menstrual periods that lasted days, but they never thought anything of it. So she had been seen in a previous center and had IVF done. And post-procedure just simply hemorrhaged. Had to be called, the ambulance had to be called. She was sent to the hospital, had to have a hematologist in. And they flat out told her, no way, no how, we're not doing any IVF anymore. And she came to see me for a second opinion. So that just piqued my interest. And I thought, you know what? This is a common enough bleeding disorder. There are a lot of people with it. Why don't I try to shed some light on it?
So tell us about some of the bleeding risks when it comes to IVF.
Right.
About people on anticoagulation or antiplatelet therapy. Tell us the bleeding risk, and in general, what type of precautions does one have to take before undergoing a treatment?
The key thing is accurate diagnosis. So I think when someone gives all those histories that they've had, nosebleeds, heavy menstrual cycles, or some people may say, you know what, I delivered a few years ago and I went into shock, I just didn't stop bleeding. I think the key thing is the accurate diagnosis. Mm-hmm. Because when you have accurate diagnosis, you can now set plans in action. The treatment for patients with von Willebrand's is a multi-specialty approach. You can't do it alone. You need a hematologist in place who understands the disease critically. They have to understand which type of von Willebrand the patient has. There are 3 types, type 1, 2, 3, and one is mild, one can be severe. So knowing exactly what type they have, putting precautions in place, having things like cofactors, factor VIII if it's severe or desmopressin available. Certainly not in an outpatient setting. And also having anesthesia be aware of what is involved. So I think it involves a multi-specialty approach because these people can bleed internally after you collect the eggs and everybody goes home. What if they open up and just bleed on the inside,
Hmm.
right? And that could, it's like a ruptured ectopic. They could die from that. So bleeding at the time of procedure, bleeding post-procedure could be a complication. And then beyond IVF, these patients are also at risk for miscarriages, right? So if you've had a long fought drive to get pregnant, you want to make sure you don't lose it. And now there's some recent scientific evidence that it may also be a risk factor. It's not conclusive yet. It may be a risk factor for the development of endometriosis.
Mm.
How about that?
So how about for people without von Willebrand's, just in
Correct.
general, what is the bleeding risk for IVF procedures?
So for people, normal patients, very minimal,
Okay.
very, very minimal. If you have a normal CBC and a normal PT-PTT, it's very rare that you have a bleeding problem. Knock on wood, I've never had any, severe hemorrhage of any of that sort. But in that, but I've also seen patients who were aspirated and maybe the surgeon hit a vein,
Hmm.
right? So you have to know, you have to be very familiar with what the anatomy looks like, on the ultrasound when you're doing your egg retrieval. So it's very simple. Don't hit a blood vessel.
Yeah. Now, do people have to hold anticoagulation or antiplatelet therapy
Absolutely.
before they go through a
Yes,
procedure?
absolutely. So some patients may be on Lovenox,
Okay.
right, because they have a clotting problem. So we usually, in that regard, I like to work with their hematologist and I like to get their suggestions. So the Lovenox, it's a blood thinner,
Yeah.
has to be stopped before retrieval, right? And they tell us exactly how many hours, days they want it stopped and how soon after can it be resumed. So if you're on a blood thinner, we need to work with your hematologist to determine when to stop it. You cannot be on a blood thinner when you're about to go through such a procedure.
Now, do you normally screen patients for these genetic hematologic disorders before they go through treatments?
I don't particularly screen for von Willebrand's. I do a overall genetic carrier testing, and the testing that we use, they test up to 780 something genes. It's a general screen, genetic screen. So von Willebrand's is one of the tests that we do. So we usually do testing for genetic testing, period, and to determine, from that if there's any risk. Then the other test that you would look at is, does someone have a normal CBC and a normal PT-PTT? If those are normal and they have a normal genetic carrier screen, they should be fine. I like to use whole gen carrier screening because it tests for 787 genes.
Hmm.
So unlike the past, where they would only test 120 something genes or 200 something genes, nowadays we test up to 780 something genes. So that's what I normally use.
Okay, so now let's getting back to our patient with von Willebrand's. So you
Correct.
mentioned a multifactorial approach. So tell us about some of the things that you mentioned, like the DDAVP, that's desmopressin,
Correct.
and factor
Correct.
concentrate. So tell us about how those work in terms of treating potential bleeding episodes.
So with von Willebrand, the von Willebrand factor that causes the problem, either you don't have enough, that's type 1, so it's harder to coagulate, or the ones you have is weak, is not as good, or you don't have them, period, right? Those are the three types. It's either you don't have sufficient of the good one, it takes a little while, you have a defective form, it's not working as well, or you simply don't have it. So knowing which type you have lets you address correctly what strategy you're going to use to mitigate the circumstances. Von Willebrand is responsible for blood clotting, for platelets forming. A platelet plug is, let's say you have a poke, a hole through the blood vessel. Platelets form a little plug
Hmm.
that stops blood from pouring out, right? So with von Willebrand's, you can't form those platelet plugs as well. And that's why those patients tend to bleed more.
And you mentioned that this has to be done each cycle it has to be done inpatient with anesthesia and hematology on call.
Once the patient has a diagnosis of, if they have the diagnosis of von Willebrand's, if they do not, if they have a normal CBC, PTT, if they have a normal bleeding time, if they don't have such a history that would make you suspect it, then you wouldn't necessarily, do all those things. But if you have a history of, or you have a diagnosis of, then you have to be cautious of that.
Now, how successful, and you don't have to like reference a specific patient, but in general, how successful are you with fertility treatments in those with von Willebrand's disease?
So with the right, I would say with the right precautions, the risk with those patients is very minimal.
Hmm.
It's the same risk as a normal person. So as with the right precautions, there is no untoward after effect whatsoever.
So after a treatment in a patient with von Willebrand's, tell us
Yeah.
in terms of the aftercare, what kind of precautions do they have to take afterwards to prevent, like you said, a bleeding episode?
So as long as you have the was it factor eight available, you have desmopressin available, patients do just fine.
Hmm.
There's no other risk as long as those mitigations are put in place. They do just as well as any ordinary patient. So they can be successfully treated if the right precautions are in place.
So any other bleeding disorders outside of von Willebrand's that you've had to deal with as a fertility specialist?
The von Willebrand is the most common one. The other bleeding disorders that we deal with is actually the opposite. It's the clotting, abnormal clotting, right? So not so much bleeding as clotting. So and those are problems such as homocysteine deficiency and all that, thrombin 3 deficiency. So more blood clotting
Hmm.
issues is what we see.
So, in terms of von Willebrand's, like that patient came to you for a second opinion after the first opinion said under no circumstances could she do IVF. So, there is hope and there is a protocol for those with von Willebrand's who want to pursue IVF.
Absolutely. I think that if they have been appropriately treated, they can successfully go through IVF.
Do you recommend going to like tertiary academic medical centers? Is this available at a community hospital? Tell us about the availability of the support.
I would probably recommend that, or at least in a hospital setting. Now, most IVF places are outpatient settings. So if I were to do it, I would either say, hey, listen, we got to take the whole kit caboodle over to the hospital, or I would say go to an academic center that can do the procedure in a hospital setting with emergency precautions available.
We're talking to Yemi Famuyiwa. She's a fertility specialist, and today's Kevin MD article is When Bleeding Disorders Meet IVF, Navigating von Willebrand Disease and Fertility Treatments. So, Yemi, tell us some take-home messages that you want to
Okay.
leave with the Kevin
Yeah.
MD audience.
So take home messages is never overlook minor bleeding histories. Take a deep dive into it, ask some questions, look at the patient's history. What's their menstrual cycle like? When they started bleeding. I think just being curious, be a Sherlock Holmes about it is what I would say.
Yemi, very educational. Thank you so much for sharing your perspective and insight, and thanks for coming back on the show.
Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.